Okay, welcome everyone to our June meeting. I am going to do a quick, actually, I'm going to wait for a roll call. We're going to do some announcements, and I have a reason for that. I'm just going to explain something with the appointed members. So I'll wait and do roll call in a minute when we discuss that, so there's not to create confusion. All right, did everyone get a copy of the agenda for today? All right, I see thumbs up. Thanks, Stephen. So welcome, and then we'll do a quick, we still have admit, quick time for public comment. I did not get any notice of anyone who wanted to do public comment, but we'll just take a quick minute and see if there's anyone on from the public who would like to comment. Please use the raise hand feature and I will call on you.
And you can do that by clicking on your reactions and then raise your hand. Okay, I think we have, I see one.
Yep, so Sarah, go ahead. You have 5 minutes.
Hi, my name is Sarah Spear. I live in Portland, Connecticut. I'm a disability advocate and the parent and caregiver of a child with autism. And Gymnast was kind enough to invite me to this meeting. So I really just want to sit and observe and just to give you a little context about why I'm here beyond what I've already shared. I have a startup called Empowered Together, which creates technology to support families impacted by disability. So we have a virtual marketplace that connects people with disabilities to accessible businesses. We've also done caregiver communities of practice. I'm going to be doing one of those at the Portland Library coming up next month. And so I really wanted to observe and just learn whatever I can from this gathering. And I'm grateful that I can observe and be here and introduce myself to you all. So thank you. That's all, Tara.
Thank you. Welcome. Anyone else for public comment? Okay. Does any of the council have any comments specific to public comment? Okay. Moving right along then. We will go to review and approve the March meeting minutes. So everyone should have received a copy of that. Is there any objection to the March meeting minutes? Okay. Then we will assume those are good to go, and I will post the final version of that. Okay. Next, we have a agency updates, and I am going to start with OPM updates. We have some of my OPM colleagues here who are doing the study that was in legislation last year on employment for people with disabilities. And they would, this council was noted in that to provide some stakeholder feedback. So I'm going to turn this over to my colleague, Heather, to introduce those who are working on this project. So Heather, you wanna go ahead?
Yes, thanks so much, Tara, and good morning, everyone. My name is Heather Ferguson Hall, and I work closely with Tara, sort of the analog to her providing coordination for services for people with autism in the state. I provide coordination for services for people with intellectual and developmental disabilities. So one of my goals has been, actually, I was going to say goals, one of my current undertakings is being a what's the word I want? It's the, because the project lead is Jake, who I'm going to introduce you to momentarily. So I'm sort of project managing that along. So Jake and I are working closely, as well as Nick Turcutt, who's here as well. Who's a research analyst. So the three of us have been busy working on this study and very eager to get feedback from the community. So with that, I'm going to hand it over to Jake.
Hi, everyone. Great to meet you all. My name is Jake Lohr, as Heather just mentioned, and I'm the project lead for the employment study at OPM. Thank you all so much for having us here today. It's kind of already touched on, but I'll just briefly talk about the employment study a little bit that we're conducting before sharing something with you all, but all of it will just take a second. So the employment study, of course, was commissioned last year in 2023, HB 5001, and asks us to analyze all the existing employment assistance programs for people with disabilities, especially intellectual and developmental disabilities in the state of Connecticut. And so we'll be using this information to make recommendations on increasing employment opportunities for this community subsequently after we complete the initial survey. So today we just want to give you all a brief informal survey about finding and keeping employment so that we can be sure to include your experiences and insights into our report and recommendations. We're really excited to have this platform for us to hear from you, the folks you represent, and others in your community. So the survey should be put in the chat now or shortly, and it will also be sent out in the meeting minutes after this council ends. And it should take you about 3 to 5 minutes to complete it, and it will be open until July 26th. Please do take the time to fill out this survey and share it with others as well who would like to share their experiences and insights. It's super crucial that we hear community voices as we work through this process, and I think you all are best situated and positioned to be able to provide your feedback and insights, both as members with experience and people who represent other voices in the community. Thank you so much, and if you have any questions, I'm happy to answer them. I know you may or may not have the survey in front of you. I didn't see if it was put in the chat, but if there's any general questions, happy to answer them. And otherwise, thank you so much. Yes.
Hi, I'm Lois Rosenwald, past executive director of ASRC Autism Services Resources Connecticut. This is a subject that's really near and dear to my heart and to the organization. And I'm part of a committee and have been for many years with the Bureau of Rehab Services for people with ASD. And I'm wondering if that committee is, on your radar in terms of talking to and getting information from.
Yeah, so that's a great question. We've been talking a lot with the BRS director, Mr. David Daukas, and so we do know about this committee, and it's also something that I'd love to get feedback from. We don't have anything scheduled with them right now, but I appreciate you bringing that up. And similarly, if you have people you know from that committee that would be able to share some great insight, I would love for you to share this survey with them so that they can fill it out as well.
Kathy Marcioni is actually on this call. Kathy, you might want to comment. I don't know on that. Is she still on the call?
I am, yes. I would. I mean, I know that you guys have been working very closely with Dave, and I would be happy if there's a survey that you would like me to get out in a different way than Dave has. I'd be happy to, but I think he's been very actively involved in this. So
awesome. Thank you so much. Any other thoughts?
Okay.
If not, I can conclude. Thank you.
Yep, thanks, Jake. So that is in the chat currently. So like Jake said, it'd only take about 5 minutes. Yana, I did see that you wanted a chance to speak. And if it's okay, I will save that to the end when we do our member announcements and updates. Is that okay?
No problem.
Okay, or was it about the employment?
It wasn't, but with the employment, I think
Oh,
if
okay.
I could share something, these surveys with my fellow self-advocates, I think you would get a world of feedback, especially when it comes to BRS.
Yes.
I know the job that I currently have right now at the museum, BRS, I got it myself. BRS would probably have put up a fight because they would have said I don't have social skills for it, or some other one of their excuses. Which is why I didn't even go through BRS this time. And I'm really happy at my current job. And I'd love to share. I have some neurodivergent coworkers that you would get a lot of feedback from.
Well, first, congratulations
That's not my
Congratulations.
announcement, what I wanted to
Okay.
talk about, but we're talking about employment. BRS, you really need to connect with them and with the self-advocates because you're gonna get your ear talked off.
Yeah, absolutely. And just to follow up on your first comment, I think it would be excellent. Yes, please do share this with other self-advocates. We would love to hear from them as well as you.
All right, but just fair warning, if you ask other self-advocates about BRS, and then you're gonna have steam coming out of your ears listening.
Thank you for the warning.
Okay, anything else or questions on the employment study? All right, well, we will get that feedback to you guys, and thank you for giving us the opportunity.
Thank you, Tara, and thank you to the entire council for taking and helping disseminate this survey, because as Jake said, the more people who fill it out, the better, and we really do want to hear from the community and people with lived experience. So, and I don't know if Jake mentioned this, but it is very brief. It's 3 to 5 minutes, so hopefully it'll be fairly straightforward for people to use. So thank you.
So then I will provide a brief update on the sister study in that legislation was on examining statutory definitions using that, because Connecticut is still using IQ in their statutory definition for eligibility for DDS services. So they are looking at that and the level of need assessment. So a contractor was identified through an RFP process, and that work has now started, and I am project managing that. Not much of an update yet because that the contract process took quite some time. So they are currently doing their research, and we will have an update from them on that initial research, looking at other states and how they're using IQ and level of need to make those determinations. So as I get updates and report outs from the contractor, I will update the group, and we will also be providing stakeholder feedback for that as well. So they will be doing a presentation at some point to the council more formally. So you can look forward to hearing more on that. Yep, go ahead, Gemma.
Hi, Tara. Just for full disclosure and transparency to the council and to the public, what is the breadth of the survey? Or do we not know yet in terms of how many states and how long the survey is going to take? I didn't know if there was anything in the legislation that said we had to have a draft or a survey like completed by state.
Yeah, we do have to have it. We will be presenting it to the General Assembly, so there is a drop dead date on that. So we have until the end of the year to complete everything for the entire requirements. But so it's currently they're doing the research, then they'll do stakeholder feedback, and then work on doing the final draft of recommendations based on all of that.
And all that has to be done by year's end.
Correct.
Okay. Great. I think that's just important just to give some context.
Absolutely. And like I said, I'm happy to provide updates along the way on information that they're providing. But currently we haven't received anything yet, a summary of the research yet or anything. So that is all coming. I just wanted to make everybody aware of that.
Yeah, I'm just thinking about like our meetings going forward for the remainder of the year and, our schedule. And I'm anticipating, we'll need feedback or an ad hoc meeting, just so that we have a chance to review all in time,
Absolutely.
to meet that, because we only meet 2 more times this year, September and November. So I'm just trying to think ahead. Okay, appreciate that.
It'll probably be the feedback with them will probably be for the November meeting.
Okay, so then it'll be a quick turnaround
Yeah,
for November into.
it may be September, but
Okay,
I mean, because we are later in the month, so maybe.
right.
But I'll have a better idea after August, from when the first portion of their report is due.
Okay. I just think it's important that this council is prepared for that, and the expectation is that everyone will be participating to provide that feedback once it comes through.
Absolutely.
Cool.
So the next thing I'm going to do real quick for updates is Brian Klimkowitz could not join us today, but he did want me to mention that there was a small group of subject matter experts that provided some initial feedback to them on guidelines for BCBAs that were developed, and that is progressing, and that will be disseminated later this year. So he wanted me to just mention that there's been progress on that. And then I would like to, I didn't have any other, Stephen, you wanted to give a brief update. That was the other one that I had listed here.
Let me unmute myself. Thank you very much. I appreciate it. I just wanted to report that Disability Rights Connecticut, who I'm here on behalf of, does an annual priority survey prior to the start of our fiscal year, which starts October 1. And what happens is the result of those studies determine what we do, and those surveys, determine what we do for the next calendar year. And so what I wanted to do was to raise that with the council because, in the past, when we have had recommendations for what the community would like to see us do, it has greatly affected what we did. Last year, for instance, we had a strong request to work on supported decision-making. And so that became a big issue. We developed a clinic which operates monthly for people who are looking to create those types of documents. We are working with the state council or commission on supportive decision making. We are, and that all came as a result of this survey and priorities survey that we do each year. I am been trying to put it in the chat box, but I am quite the incompetent when it comes to dealing with technology. So I will get it into the chat box for you all to look at, and it's going to be the QR code to get you to that survey. It's unlike what Jake said that he'd get his done in 5 minutes. The one we have is considerably longer because, of course, it's designed by lawyers. So we will, in fact, just ask that you go through it. And if there are areas that you think are important and that should be looked at from a legal standpoint as it relates to persons and families with autism, we'd really like to hear from you, because I personally would really like to make that a priority for the next year on behalf of Disability Rights Connecticut. So that's basically what I wanted to report. And thanks very much, Tara and Jimna, for letting me make this announcement. That's all.
And I did get a copy, so I will include that in the meeting minutes as well, Stephen. So if something goes with the chat, then I'll make sure that is disseminated for you.
Very good. Thank you very much, Tara.
Absolutely. Okay, so now it is my pleasure to introduce Christine Weston. Christine is going to be our new designee from DSS, and she is going to be providing updates for us. Go ahead, Christine.
Hi, good morning, everyone. Thanks for having me here today. Very excited to be a part of this council now and get to meet all of you and hear all the great advocacy work that's going on in this space. I thought I'd first give you just a little brief background on myself. I won't take more than 2 minutes. I won't bore you. And I think some of the individuals on this call might know me from my other experiences in the department at the state. So I've been with the state 14 years now in a variety of capacities. And prior to that, I worked at a private nonprofit in the HCBS space. So currently I'm the Director of Community Options for the Department of Social Services. And what that encompasses is all of the home and community-based services that we serve to a variety of members. That includes the autism waiver, the home care program for elders waiver, PCA waiver, acquired brain injury waiver, also the Money Follows the Person program, Community First Choice, and CHESS. So the Home and Community-Based Services division in DSS is quite large. And as you all know, the autism waiver sits there, and that's my relationship to this council now. So I'll be coming into these meetings to provide updates on the waivers, be available to answer questions. Also, if you wanted to have any stories coming out, or if you wanted to hear directly from members that are receiving services or the case managers that are providing the services, I'm happy to provide access to that. If you're interested in those types of experiences and stories about what's working and what's not, happy to provide that as well. So again, on my background, I've been here for a very long time at the department. I started at BRS, so some of you on the call, I know you as well. Worked as a care and case manager for the ABI and PCA waivers, worked to transition individuals out of nursing homes in Money Follows the Person, moved to support some technology projects to align siloed program systems that don't necessarily talk to each other and can't always inform holistic habilitative care plans for our individuals. And then came back to Community Options now to be the director and help support those great programs and our members in DSS. So do you want the waiver report out now, or is that at a different point in the meeting? Tara, is that okay?
Yep, no, now's good.
Okay, so, and I'm not sure if you guys like numbers, or like I said, if you want to hear more about the personal stories, the successes, what's going on, I really would like to be able to offer that as an opportunity. Numbers are great and it's helpful, but also the actual good work that's happening is really critical as well. So I would like to extend that for a future meeting. Right now we have 243 total active waiver participants. And since the last flush of 200 spots that were offered by OPM, we have 123 of those spots fully active on waiver services. We have about 25 applicants that are in a pending status, trying to get through the Medicaid process, the disability determination process, and then they will be active on services, hopefully within the next few weeks. We had around 80 people removed from the wait list of late as we've been going through the wait list as OPM when we offered up those additional spots, and we have a next round of spots starting in this next year. We've already had to remove around 80 individuals. That's just because of the length of time people had been on the wait list, right? So they've either moved out of state, no longer interested in services, receiving services through another mechanism, didn't want to comply with the Medicaid process, after, waiting nearly 8 to 10 years for services. And then you understand the complexity of the Medicaid application and what we ask of families and individuals. Some people just didn't want to comply with that process, and that's understandable. And that's very typical when people in any group that are reaching out for home and community-based services, the Medicaid application, and that is a barrier at times for people. So we're working through that. Mike Olson's on the call as well. He is the autism supervisor, and we have a swath of case managers on the call as well. So they're all every day coming in, doing the work, helping the families get onto services, making sure that their care plans are staffed and taken care of. And really, we do have a dynamic team at the department, and I'm really looking forward to getting to know them. I don't know if it's been announced broadly, but Amy Dumont, who's been the long-term autism waiver care manager, is leaving the Department of Social Services for another opportunity. And we will be having a vacancy at the manager level for the autism waiver. So I'll be working with the department to determine if, the timing that I'll be able to fill that. So I'll be covering managerial responsibilities in the interim, working very closely with Mike, who's been a phenomenal supervisor in this space and a wealth of information and support for me. So very happy that he's here with us. And really that's what we're doing at the department. I'm really open to conversations. Judy and Tara have already talked to me a few times. I understand the strong advocacy around this space and want to be available and accessible to individuals. So yeah, that's really what I'm doing in these first, I think I'm at 2.5 months. So bear with me. I've asked for a little bit of grace, a little bit of understanding, especially as we have some with the manager vacancy in this space as well. I will do everything I can to be as attentive as possible. So Judy, Tara, that's what I got.
Thank you. I know that Jennifer Crom couldn't join us, but I just wanted to open it up to council members to see if there were any comments or questions for Christine. Yep, go ahead, Lois.
Yes, I was wondering what the division is planning in terms of the crisis that we're in right now, given the shortage of providers available for the waiver. I'm talking about specifically for the waiver.
Yeah. So Lois, your timing is very good because I just got an email saying, what are we going to be doing about provider credentialing and how are we going to work through this? So I'm not fully read into what you might be identifying as a provider crisis for this space. So I would need to take that back to the team. I need to understand, is it globally? Is it a very specific waiver service that we're having an issue with? Is it a pocket in the state? I know HCBS in general is having a provider issue. I don't know if it's unique to autism or if it's something very specific about a specific waiver service. So I would need to get some more information on that, Lois.
My information on that, and I think it's pretty up to date, is that we are in crisis in terms of providers for the waiver in general. It's been one of the biggest problems, I believe, in getting these 200 people really up and going. And I know that we've received at ASRC many calls over the last probably 6 months about families who have, lost the providers and not been able to replace them. This has been a crisis for years,
okay.
But given the pandemic and the situation surrounding that, it's really complicated everything. And also because, and I really think this needs to be discussed within this committee, because of the fact that so few of our folks receive services. You just don't have providers that are training folks for this population, given the lack of funding here in the state. So this is a real problem because even when families are able to out of pocket, buy services, they can't find people to provide them.
Okay, so Lois, I'm going to invite Mike Olson to come and speak to this a little bit, just because he's a little bit more in the day-to-day space for this, and then I will certainly take this back as well. Go ahead, Mike.
So the number of providers we have is not the barrier for onboarding the 200 people. That's really finding the people, getting them through the Medicaid process, people agreeing for the waiver. We have added, through a lot of the work of our case managers, 15 new vendors in the last 6 months. So they've been making a great deal of progress in that. We do still have issues with certain vendors having staff available, especially in certain areas of the state, but it hasn't been a barrier as far as onboarding. And like I said, the 15 new vendors we have, and actually we just have another one today that's going through credentialing. So there has been some improvement.
Could we send people directly to you, Mike, and we get those calls?
Yes.
But that's just different than what we're hearing.
Right. So like I said, some vendors are having difficulty getting staff. Some people choose not to switch vendors and don't want to try someone different. And there are some areas in the state, you go up near Enfield in that area, it's tough to find staff. There's, some of the Fairfield, Norwalk, Greenwich area used to be very difficult. And one of our case managers was able to get 2 larger vendors started in that area. So that's been a great deal of help.
how about Shoreline? Because we're getting calls from people on the Shoreline, Upper Shoreline, and also the greater Torrington area, Litchfield area.
The Shoreline, we have probably 6 different vendors off the top of my head that cover that area. The Torrington area is a little harder, but there are still, vendors that are up there.
Okay, well, I'm going to send them, we'll send them to you.
Nope, that's fine.
And because we haven't been sure what to do, and we have received many calls. And I think, the broader issue is that families, when given, okay, and I don't want to take up too much time, but I think this is such an important topic. I think that the broader issue is that when families are given instruction, whether that be from their psychologists, any of the providers they might be working with, or the BRS committee that I sit on as an advocate, when they're given recommendations to find people to do the work, they can't find them. They're not out there. We have a crisis in this state. I know that, for trained people to do these services, and we need to address it.
So what we'll do is, as the department, so I'm going to ask Mike to post the link for all of our active providers and by the areas that they serve in the chat. We will take it back. There are likely pockets, Lois, and I do understand, again, HCBS in general is having a hard time with retaining and maintaining staffing the care plan. So we understand that. It would be very helpful for you to send over the inquiries so we can understand if it's a targeted area or if it's a access to information issue. So we'll take that back. But I see, Tara, a number of hands. If you want, I don't know.
Yep, I was going to go in order. So
Okay.
Yana, you're next.
So I just wanted to talk with, because I've been having my own issues as an individual receiving services and finding staff. And I know that I don't have to say this because we all know with autism, we don't do well with change. And if I want to work with somebody, I need to build in the trust. And I've not had a chance to do that. With the agency that I'm with now, I've had 3 to 4 people already this year, and it's June. And now I just had my IP meeting, and now I'm saying that I'm tired of the musical chairs all the time, and their staff at this point, they're causing me more aggravation than they are being helpful. And I think a lot of people would say that because I'm seeing from when I started into division in 2009 to now, the quality of the quality of the staff and the supports have slipped dramatically. We used to have the agencies would do social events for their individuals. When I went to, they used to have staff that were qualified, that were trained, that stuck around, I built a good relationship with. But I don't have that anymore because now it's musical chairs, and we know that people on the spectrum don't do well with change unless it's the kind of change I find in my pocket. That's the only kind of change I enjoy, but I don't do well with change. So we do have a crisis. We need to be finding more qualified people, and we need to be paying these people more, giving them benefits so that they do stay around, so that our folks can build relationships. And we do need better training. I had an incident with former staff where I was out in the community with her, and she ran into somebody that she knew from the community, and she basically, I don't know, the training must have been not there because she introduced me. She said, "Oh, this is my client. I work with people with disabilities." And I was really annoyed with that because you're not supposed to do that legally. And legally, you're not supposed to do that. Like, where's the training? Are they just hiring people from off the street who don't have any qualifications for working with this population, and they're not doing training as well as they should? That's something that's so basic.
Yeah, I
would
certainly
love to be
appreciate
involved
that
with the training.
personal experience, and it is I recently was able to participate in a session on the Office of Workforce Strategy. There is a statewide campaign and effort to make sure that healthcare workers are that we have training opportunities, that there's career pathways, that people understand the importance of this work, and that that at all levels that there is a career pathway for healthcare workers. And what does that look like? What we're finding is that there's a lot of different names and types of services and people with different requirements and different certifications and who goes where and what program pays what person what, right? So I think that the problems you're talking about are systemic. I do apologize that that's your unique experience, and I don't want to diminish that, but yet we have a problem, right? We have an expansion of home care, and we don't have the expansion of the QA and the supports that we need and the alignment for the universal quality management, the universal training, the expectation set, right? We rely on the providers to make sure that they are going to be providing.
Yeah, and then there's no oversight with these providers.
Right. So that is something that,
run wild.
Yeah. Yep. I don't have the solution yet. I have for years, even my predecessors have always talked about proactive quality and management. How are we going to get into the providers sooner and not be reactive to situations, but make sure that they are set up for success to begin with, right? And that is a long-term plan that I am trying to coordinate under this new role that I'm in, but it's going to take time. So, but I certainly hear you, and certainly aware of that concern. So sorry for that.
I would love to be part of the training. I think self-advocates should be part of the training process, absolutely. Just like they are at DDS. When I worked at DDS, we were part of the onboard training. We were training people, and I would love to be part of that, onboarding the new staff and letting them know. Because you're right, this is a different population. It's a little bit different working with our population than working with people with ID. It's a different animal, and the staff doesn't realize that. What I'm hearing is that we're taking new people on the waiver, and we don't have staffing for the people that are currently on the waiver, and that just doesn't make sense. We should be staffing the people that are currently on the waiver, and not adding on to the pile of people that need to be staffed. And Carol at ILC, you're one of the good providers. You don't put up with any nonsense. You treat your staff well, and more.
I was gonna
like ILC.
I was gonna say we do see some providers with their hands up. So why don't we give them a chance to talk? I appreciate that. Thank you. Go ahead, Sarah. Dr. Schlegel, are you there?
Oh, yes, I didn't hear my name. I think somebody else is talking. Hi, everyone. Good morning. I'm Sarah Schlegel. I am a developmental behavioral pediatrician at Connecticut Children's, and I sit on this council as a physician who works with individuals or sees patients with autism spectrum disorders. And I wanted to just follow up. Lois had mentioned the lack of providers being available as contributing to the crisis, and I thought it was interesting, Mike, that you didn't feel that was the primary issue, and I'm interested to hear, because you are in the thick of it. Could you tell us what you think really the main challenge, or what should we prioritize and working on? If it's not the staffing, what do you think is the biggest barrier? I recall in previous meetings where we are constantly talking about the autism waiver wait list is 2,000 people regularly, and then we're talking about people getting services are in the hundreds, low hundreds. So to me, there's a barrier of getting off that wait list. So I'm curious, what's the barrier? If it's not the staffing, what do you think it is, or what should we be targeting?
So the biggest barrier we have found is getting people through the Medicaid process. We've made some changes that have made that much easier. We have a cover sheet that they now submit with their applications that have their case manager's contact information, so the eligibility worker could contact them directly. The issue being, though, is we're dealing with people that have a developmental disability. Their responses, their ability to get the documents they need, their follow-up isn't always the greatest. So it's a long process for some people. That is our biggest barrier. Going forward, for the next 120 people, preemptively, we sent out a letter to each of them, letting them know what the requirements were for Medicaid, for disability determination, and a basic outline of what to expect for things to come. With the responses of those, we were able to update our address list and finding people, because in 10 years, people move. We had an intern, I have a staff now who went through and got Medicaid numbers for everyone that has a Medicaid number in that 120, and they were able to go into our system and update their address so that those things will move along quicker. But it's really just finding people, getting them through the process. Some of them need a disability determination. We have maybe 5 or 6 people going back to DDS to be reevaluated because some of them went on our wait list. They were 7 or 8 years old. We have some people, it's taken some time for them to decide what they're going to do. Everybody's situation is different. We had one individual, the mother was starting the Medicaid application. She was diagnosed with brain cancer. We're not going to kick her off and make her, go back to the bottom of the list because she's going through chemo. It's every individual story is different. Now, getting vendors, getting enough staff is still an issue, but it's not the barrier for people getting on the waiver. And it has actually improved quite a bit in the last 6 months. During COVID, it was horrible. You couldn't find anybody to work. But in the last 6 months, it has improved. We do have a good training program that was updated, I want to say 2 years ago, and CCSN provides the training for our individuals. As far as each agency providing their own training, that's something that needs to be looked at better, agency by agency. We are ramping up and doing more of the quality assurance checks with our agencies to address a lot of those concerns. The biggest thing I've seen as far as people that have staff is teaching the staff life skills sometimes. That while they may be qualified, they may not know how to cook or how to balance their budget or how to, those barriers. So that's a challenge for the agencies.
Thank you. I look at our role as providers who refer to you, or refer our patients, clients, et cetera, to get on the wait list. Certainly as part of our job to be proactive and in supporting you and getting the documentation in line so that they're as ready to go as possible. And again, I understand there's extenuating circumstances, et cetera. I think the other issue, obviously, and again, out of your control, that I see is the way services are allocated, or the way funding, is allocated. And obviously if we're taking only a few 120 off of a list of 2,000, and I too have an enormous wait list. So I get this, but I think it is, how are we allocating services to the people that need them? And so again, I think on a higher level, maybe speaking to some other people on this call, that would be something we should really advocate for as well.
Oh, definitely.
So thank you again.
We have a timeline. So we're getting 120 this year, 200 next year. And in 2022, we had 120 slots. By 2025, we will have 700 slots. So, it's not the full wait list, but it is progress.
That's fantastic. Great to hear. Thank you.
I believe, Carol, you're next.
Okay. I'm just going to say, sort of as a provider, the issue is that all the providers are trying to access a very small pool of candidates, relatively. And since 2016, when the insurance mandate kind of came through, we're competing with private insurance. And so private insurance will reimburse 50 to 75% more than Medicaid will. So for me to be able to get staff, and that's the reason why, I'm sorry, Yana, that you're having all the bouncing around, but I think that's the biggest thing, is that people are just jumping from job to job to job because people are being offered more and more money. So it's really hard to compete. If we're being reimbursed for $50 an hour for somebody, and an insurance company is reimbursing at $75 or $80 per hour, which is the fact, we can't pay as a Medicaid provider. We do both. So I know all the numbers. But as a Medicaid provider, just a Medicaid provider, you can't compete with people that are, paying that much money.
Thank you. Jim and I think you were next.
Hi. So Mike, when you were talking, I had a question. Come back to me. I wrote it down. I can't read my own handwriting. I'm sorry. Go ahead, Lois.
Okay, go ahead, Lois.
I have two questions. First, Mike, you mentioned that you have a training series or program, and that you're happy with. what, you know, one of the really difficult issues with providers currently is a lack of training. And is there any kind of requirement that people go through this training now, or is it up to the provider agency to, you know, to either offer the training to people or not? What is the situation?
There's a requirement for them to attend the first 2 portions of the training, and then there is ongoing training that is voluntary. They also offer CEUs, and unfortunately, we do not have a huge amount of participation from our vendors for people doing that. I would like to see the language edited in the waiver requiring annual training, or that they keep up with the training, but then it becomes a cost prohibitive thing for the vendors to be able to provide that. So the cost would have to be figured out, who's covering, you know, paying for the training is one thing, paying for the staff time is another.
Well,
so
we need to be educating, and I mean that in the nicest way, but we need to be educating our policy people as to how important this is. I mean, I was part of the team that developed this waiver, and I know that the services work, but the services are only as good as the people providing them. It's as simple as
Preach,
that.
Lois, preach.
no, and I agree 100%. And we have, you know, like I had said, we have some providers where the staff are wonderful with our individuals, but they're lacking the life skills themselves, and it makes it very difficult to teach them. So one of the things after meeting with one of our vendors is I would like to start is quarterly meetings with all of our vendors to discuss what issues they're having, to look at different training opportunities, because that's just something that hasn't been done in the past.
Well, I have a lot of ideas around that, but I'm not going to take up the time in the meeting right now to give them. But I think there's a lot of work to be done, and I think that we seriously need to be looking at this and what is working and what is not working, and how we can develop a steady stream of people to do this work. And for many years, I've suggested that we use the community college system to do this, but that would be a very long conversation, and I'm not sure appropriate at this moment. But we need to seriously be looking. We are in a crisis. Thank you. Appreciate it.
Thanks, Lois. Sorry, I recalled what I was going to ask. Dr. Schlegel, when you go through and a patient gets a diagnosis, does your staff or does your office, do you have anything like a medical home or like a care manager or a case manager that kind of can help inform or assist with these? It sounds like these applications are really difficult. And then the question would be to Mike on your end, you know, you're getting, you know, you have slots and you're servicing the individuals on the waiver. And so you need your case managers dealing with those people that are active, but then do you have staff that also is assisting with the application? So I guess my question is kind of twofold. Dr. Schlegel, I don't know if you want to respond first.
Sure. So I will say I don't know what is available to adults. You know, really through 21, they certainly, our patients certainly have access to the Connecticut Medical Home Initiative for Children and Youth with Special Healthcare Needs, which serves the entire state of Connecticut. Any child with any kind of special need of any degree can work with these care coordinators who can, you know, assist families. So we do a lot of, you know, referring families to those program. And there are other social workers and, you know, other programs that can certainly support families. You know, and again, I'm certainly happy to work directly with Mike and make sure we are sending people to complete all that they need to complete in order to be prepared. We do send them to get themselves on the wait list. And so, sure, I would love to make sure that they're on the wait list and have all their boxes checked and everything done, you know, as much as possible. Granted, they will be waiting for a while. They may need updates, as we've discussed at this meeting before too, but we would love to get them as you know, thoroughly, you know, in line and ready to go as possible. So the quick answer is, yeah, there are some care coordination programs for children through 21, but I don't know after that who is able to help them with that kind of work.
Yeah, I'm just trying to think as far upstream as we can get,
I agree.
and setting
I
that
agree.
expectation. So that was my interest. Mike, I didn't know if you had a comment or if it was answered or
There's two
not.
different applications. You're looking at the application for the waiver, which isn't nearly as arduous as it is for the Medicaid application. There are individuals at DDS that can help them with the applications and 211. As far as the Medicaid application, the case manager helps out a great deal with that. We've actually taken the form, done a sample version of it that we now send to families as well, with the areas that are highlighted that they really need to look at, and try to make it as easy as possible. We've also been working on putting together a resource guide that can go to families that aren't even on the wait list. It just can come from the school systems, because I can't tell you how many school systems don't know what services are out there. And you know, there's no book. So this has got links for applying for DDS, DSS, 211, energy assistance, food assistance, daycare, internet. So it's something we want to get to put together that everybody in the state can access through their schools.
Yeah, I'm wondering, without, you know, I know Brian couldn't attend, but if there can be a tightening up of informing, you know, by DSS to, you know, to his organization.
Once I finish getting this resource guide done, working with Brian to see maybe as part of the PPT process and all the paperwork families are given with that, this could go with it, you know, rather than the the protected right things that you sign every year and you can wallpaper your house with. If they could get this resource guide with it, so you know the families are actually getting it.
Yeah, in fact, I'm actually shocked and disappointed that that hasn't already been standard in the state. But anything I think that we can do upstream, Dr. Schlegel, as you mentioned, you know, you'd be willing to do, and Mike, I think these are great ideas. Lynn, I know I'm taking up your time. Go ahead.
No problem at all. You know, I don't want to oversimplify this, but you know, I think Christine hit on it when she talks about, I mean, this is what we're feeling in the autism community is what every human service and healthcare provider and others are feeling. I mean, we experience it at the hospital. I'm the chair of a group organization that has day and home services for individuals with autism and intellectual disability, and they're experiencing the same thing. So it really, I think, fundamentally, a lot of it comes down to two things, right? Money and training, and the two go hand in hand. And I think working through the Office of Workforce Strategy is probably a really important step. And it's on me, I know, to schedule another meeting where we're looking at, you know, education and training, because that's been resonating with me as folks have been talking. That it is just, it's very challenging out there. And, you know, our populations that we serve, it takes special people. We want the very best people working with them. The reality is that there are way more jobs and competitive jobs. And for those of us who serve primarily Medicaid population, you know, like we do here at the hospital and others on the call do, we are competing with, you know, that's the struggle. So I'm not offering an answer which isn't helpful, but I do think that we're kind of circling the drain, and it really is around a broader workforce crisis that we have, and it's not specific to the autism or intellectual disability population. So.
Hey, Marcia.
Thanks. I just wondered, is that resource guide only applicable to people up to 21? Are there any aspects of it that would be useful for people over 21? And would there be a way to get it, you know, to them if it were?
So I just added it to the chat. There are resources for individuals over 21 as well on there, but I did kind of gear it more towards children, so that in the hopes people would start earlier.
Thanks, Mike. Who is managing this and how exhaustive is it, or how frequently updated is it?
So it's something I've been working on with my staff to get it together. While our resource manager does a wonderful job for what's on our website, if people don't know the website's there, they can't look at it.
Right.
So this is something I started putting together, and I've been working with my staff to expand it, because we have staff that are from DDS and DCF and different experiences, so they have different resources that we could add to this. And if anyone has any suggestions of resources to add to this list, that would be most welcome.
Just seems like there's so many siloed resources, and for families just navigating this, or even, with a new diagnosis, as well as coming off, school services, it's not easy. So I appreciate anything you can do.
Right. I mean, whether you've got a kid with special needs or not, just trying to navigate the resources that are in the state is very difficult.
Yeah. Yeah. That's why this council has been formed for interagency, brainstorming and workshopping and trying to problem solve and pull this together. So I really appreciate this discussion. I don't know for Christine, I'm going to circle back to you. I didn't know if you had any other updates or anything else that you wanted to just comment on, just to wrap up the DSS update.
This was a great conversation. I appreciate the information and the frankness. Frankly, it is helpful to hear. Again, I certainly can't solve all of these problems. Like we said, we have systemic problems statewide with a lot of areas, but I can do our best to be transparent and open and communicate what we are doing, right? So the fact that Mike just said we had 15 new vendors join in the last few months, I think that's an important statistic that we should start bringing back to you guys and letting you know that as we're building provider capacity, that's a solution partly that we're trying to mitigate this issue, right? So just please feel free to come to me if there's things that you're looking for. I'm gonna, as I start participating in more councils and more boards, I will refer back to this group. And I did want to just close out, if there are like a family forum or something that has a large number of people where we could meet a number of families, we do have staff that go out and help support the explanation of the Medicaid waiver application. So so applying for Medicaid is very easy. Applying for Medicaid long-term services and supports is not. So the W-1 LTC is an extremely complex application. There's a lot of words around investments and annuities, and what's an annuity, and what type of insurance are you allowed to have, and the age-old prepaid burial funds that, like, I remember back from my DDS days where everyone had the most elaborate funerals you could ever imagine because of, it was one thing that you could purchase, right? So I just want to make sure that you guys know that we do have resources available. So if there is a large forum, now we can't do dozens a month, but if there is something that you all collectively do, if there is a large statewide family forum or something that you would think it's a breakout or something that could be helpful, we could deploy our waiver team trainers to do that for you. We go out to senior centers, we go out and we speak to other state agencies. We do this. So just let us know if that's someone, if you want that training.
Yeah, I wonder if, I don't know if Representative Exum is still on the line, but if, I know she had been, but something like, she's in the community and I know she's held forums. I'm up here in Litchfield and Torrington. So, I know that we've had special forums as well within the community. And of course, I believe we have a number of members of the public here that either are family members, on the spectrum, and they have support groups. I'm on a committee for my local support group here in Torrington. So yeah, if that's, if we haven't taken advantage of that already, then putting that out there is, I think you can expect some, hopefully after this call, you'll expect some requests. So Christine, so thank you for putting that out there.
Christine, we're doing a resources fair we do every year. And hundreds of people go through that, and we do lots of workshops. And so I'm going to make, I'm the retired executive director, but I'm going to make a request that you be included and do one, and we really advertise it and get people there. If you can do it. I just needed to say that, and I'll move on, but I think it's really important.
So I put my email in the chat. Send me the information, the expected, you know, the attendees, the date, the time, and what it looks like, and I'll see if the team is available.
Okay.
Great.
Okay.
Oh, Lois, about the fair, my mom and I used to go every year, but a lot of the resources at the fair, like the ASRC fair, I'm noticing they're mostly directed at families with younger ones, and it's mostly ABA providers. So a lot of it, that's my own observation. I could be wrong.
Now we have a lot of resources for adults. I mean, adults have always been ASRC's, you know, largest focus. So I don't know what to say. You know,
I remember when the support group started. It started in 17, remember?
Yeah.
Yeah. You thought I was too young.
Yes, I did.
I just wanted to briefly mention too, if you know, there's cross system issues that are coming up, please also just remember to reach out and make me aware of those as well. Part of my position and role at OPM is to help with the coordination across systems. So, you know, please make sure that you're including me in any of those barriers that you're seeing as well. So. And then Marsha.
Lois, maybe you can speak to this, or someone else can. We've been talking about the waiver, so I haven't asked this, but while we're talking about, you know, musical chairs and issues for adults, I have some young adults who are being, in theory, helped through the Department of Vocational Rehab in terms of having in terms of finding jobs, and that has been completely musical chairs, that someone's lined up with them. There's a lot of enthusiasm about it, and then basically it sort of drops off the charter. The client is told to go, you know, look at Indeed, and then somebody else comes on, and I think they're on their fourth now, but there really hasn't been a lot of meaningful support and follow through. I mean, if I realize it might be difficult to line up a job, although, you know, these people certainly have excellent skills and capabilities, but you know, as Jana said, the musical chairs aspect of it has just been really difficult because there's never a follow through, and he's just sort of left. They're just left sitting there.
I couldn't respond to that, but Kathy Marcioni, I'm sure can. She's Kathy.
Yep, I'd be happy to. Happy is probably too strong a word, but we have, I wasn't going to chime in because our experience at BRS is exactly the same as what's been described here about providers, and many of the services that we provide to youth, particularly in school youth, we subcontract with providers, specifically vocational providers, so different than some of what's been talked about here. But we are having, you know, very serious problem with having enough providers, them having enough staff, them keeping staff. In addition, we are, for the first time, at least in my memory, having more turnover than we've had before. I don't want to compare it to the providers. If any of our providers were on this call, they'd say, "Oh, it's not the same." But theirs is certainly. What they're facing is much more significant. We are facing it too. So where we used to be able to say, well, at least you'll have the same BRS counselor, we can no longer, we can't say that with any integrity right now. We have a higher turnover, and our staff do. So Marcia, what the youth you are working with are experiencing is unfortunately for me, not a surprise. It's a nationwide problem in vocational rehab right now, being addressed at both the national and state level. We're applying for some grants very specific to this. We've brought in some university technical assistance, trying to come up with solutions. We've seen some progress, but long way to go. What I would ask is, when any of you are working with an individual who is having that problem, doesn't know who to reach, their counselor's gone, they're not hearing from their provider, they're not hearing from their counselor, go up the chain of command. You all have my contact number. You can reach out to me. If you want to reach out to the supervisor or the regional director first, that's fine. You don't have to. But just because it's a problem does not mean it's not our responsibility to solve. So please, you all know how to reach me.
Yeah,
Could you put that in the chat?
Yeah.
Say it again.
Put your contact info in the chat, just so it's kept in the meeting recording. Thank you, Kathy, and thank you very much for making that that statement. You know, we do have a shortage, but it doesn't mean that these individuals don't deserve the help that they need.
So moving along in the agenda, I have two more updates for OPM. One is that we had mentioned what we were hoping to get a pilot going for supportive housing for adults with autism. Unfortunately, the provider the small amount of funding is still protected, but the provider who we had identified to start doing the work, and if you remember, I reported out we were going to use a similar model to what Demas does with supported housing, and that fell through. Unfortunately, in the budget, and more funding was needed, and this not being a budget year, that was hard to not accessible to secure additional funding to make that happen. So the small amount of funding that we do have is still protected, but the provider said they couldn't get that up and running with the amount that we have. So that is something that we still need to look at. I know we do have a housing subcommittee, so there is some additional work that needs to be done to progress this forward, so that we can find options to move supported housing forward. That's something that we can discuss more in the subcommittee, but just wanted to provide that update since I had reported out on that previously. So unfortunately, we are stalled again at this pilot not moving forward. Then the last one that I referred to before, as we announced previously, when this council was moved to under OPM and the legislation was changed, we needed to get new appointment letters. So I had reached out to all of the specific legislators that were noted in statute to appoint each person. I still have at this time 6 outstanding appointments. So some of you, again, I have just passed along all of the information. Our hope was that everyone would continue to serve and be appointed to the council. I have not heard back from a couple of those, a couple of people, so I'm still waiting on that. So again, just know that I am doing my part in working at trying to get all of the appointments secured. So I did, I will be reaching out to a few of you to get some additional information. Secretary Beckham has offered to assist me in reaching out to those specific legislators. So I will be reaching out to a few of you to get additional information. So if you're somebody who already has your letter, and everything's good. Great. There are just, like I said, a few outstanding that I will be following up on. Jimna, I just wanted to make that announcement before we did like roll call or something so people would know why their name wasn't potentially called.
So just to clarify, for those 6 outstanding appointments, the individuals may still attend the meeting. This really comes down to their ability to, if we ever had to vote on anything as a council. Is that accurate? I just want to make sure that that's clear.
Yep, that's correct. So, and because, we had been pushing off bylaws and updating those because I was hoping to get all of the appointments secured. We still have a quorum according, to the previous bylaws. So we are able to vote on that today. We have enough people in attendance to move that forward. But yes, so there would be some people that would not technically be allowed to vote because I don't have updated appointment letters. And the previous letters are not valid currently under current statute.
All right, thank you. I wanted to clarify that. And then back to your previous statement about the supportive housing. Remind me, I serve as a parent of a child of autism, so I'm not completely up to date on all the legislation and budget years and what have you, but what happens at the Capitol. So when are we up for a budget year that we may be able to look at that as an opportunity again? As this, again, supportive housing we know is a crisis as well. And as a council, I'm trying to, as the chair, along with Yana, I'm trying to decide what the priorities are, or at least get this group motivated and understanding what channels we do have and what we do have control over. That was going to be that's a good segue into some of my comments that everyone saw on the agenda as well. But Tara, can you remind me of that?
So this next legislative session will be when budgets are discussed again.
Okay. Judy, you're on mute if you're saying something. Oh.
Sorry. Agencies will submit their budgets in September again. So, and they'll be reviewed and the governor presents his budget in February. And by next June, there'll be another budget for the next biennium. But I've not given up hope. I think we need to keep working on, what's the expectation, who would get the services, and maybe the provider thought that we were going to be doing people that needed more service than less. We just have been very busy, so we haven't really had a chance to reach back out, but I'm not giving up hope, and I don't think anybody else should either. I think there's something we definitely need to work on through the coming months, and hopefully the budget would have more resources to help fund whatever we get set up. So, I don't think Tara was saying that we've given up and we're not going to do anything. We're just going to work on it, but we need to talk about who would live there, and what kinds of services those people would need. And maybe they're less intensive if we don't have the money to do, huge wraparounds.
Thank you for that context. Tara, go ahead.
No, I just was going to thank Judy for the additional information, and I agree. But it would be great if the subcommittee that is working on housing could continue to have this conversation and try. That's a great space to continue to push this work forward. So I would encourage people to continue that work.
So Stephen and Lois, I know the two of you are on the subcommittee. I don't know who else from an agency. Is anyone else? I just don't know all the committee members that are on the housing. And if you have enough, if you are informed enough, because we can make kind of a, I mean, I'm at the point as co-chair with Yana where I'm going to be calling on, you know, agencies. We need people to get motivated to help prioritize this for the two of you. I know you can't do this in a vacuum without some help. And I just don't know what else I can do to help this, to move this along for you or inform for you.
Well, I think we have to come back together as a group and meet. I know we've been waiting for a few of us to be appointed again to actually do the work, and that's not happening. So, but no, and in answer to your question, we don't have enough people. You know, we've asked for volunteers, and we have not gotten them. We have a few people outside of the council who have volunteered and are working, but there are a lot of people sitting, quite honestly, there are a lot of people sitting on this council that are not doing some of the work. And I think some people need to step up because this is I'm not going to lecture. I'm not going to go on. I think we all realize that this, or should certainly, that this is an important piece and it needs to happen. I mean, it's very discouraging to me personally. I mean, I'll stop there.
Stephen? Yes, I agree with Lois. I would be happy to provide you with a list of the committee members we have thus far. And we do have a list. However, many of them have not been to any meetings or to very few meetings, although they indicated that they had an interest in doing this. So we really do need help. We've been trying to do research from not only around the state, but from around the region, as far as housing and how they're putting together their plans and what they're doing. But, you know, we need more people to help us do that.
Well, that's very disappointing to hear. I mean, all of us are sitting on this council 2 hours every other month, and you've all been appointed. Well, all but 6 of you on this council. And I'm just really disappointed as a parent and as a chair that if you are not taking your role seriously, that our supportive housing subcommittee is sitting here saying they need help. And we have the collective people on this call to help them. We all know that this is a crisis. Tara and OPM have been appointed so that they can manage this across all agencies. And I'm issuing a challenge to each of you. This is not acceptable. This is not. I'm really disappointed to hear that report continually from Lois and from Stephen each time we meet. I'm really disappointed. You know, I as a parent, I joined this council and I've been appointed chair with Yana, and she sits here every other month doing the self-advocacy work that she needs to do. It's disappointing. And I really want to issue a challenge to everyone. We've got, Judy, you said October and then February. Those are the two, that's your timeline for the next biennial budget?
Development of the next biennial budget.
I just don't know, you know, Tara's sitting here, OPM's been here. We need people to step up. I don't know, and I'm trying to put together, you know, what our priorities are going to be. I read the statute and I know that, you know, what we're supposed to be doing under this legislation that was passed last year. I am appreciative, Christine, and Mike, that you come here, and Christine, I'm super encouraged by your participation and your willingness to lean in. We have not historically had that from DSS. Not a lot of transparency coming out of that role. I mean, Mike has frequently been reporting the numbers, and I'm super encouraged to see that providers are getting credentialed. It looks like in the chat, he said we've had some more today. And you know, but we have a job to do that each of us have been appointed to do. And my expectation is that the members of this council, you've been appointed. The expectation is that you're going to be sitting here and that you're going to be doing the work and that you're going to report back. I'm going to get off my pulpit. Go ahead, Lynn.
So, I think maybe a suggestion is to start with this, again, is not dissimilar. We've only had one meeting regarding the workforce, but again, even that meeting, I think we have people who were interested but weren't able to attend. So I think putting more rigor and structure around that in our meetings in general, and recording attendance of those meetings and sharing it with the council. It's not to shame people, but just I think sometimes for awareness. And having an expectation that everybody on the council does serve on at least one committee, for example, something like that, because I think it's not unique to the housing committee. And so if I could maybe ask that we start with every council member getting a list of the committees with the chosen chairs and the level of participation there, and agreeing to a cadence. I know we had talked about, for example, at the education committee, really looking at trying to do something monthly, and getting a schedule out on those, because I think that that's the challenge, is when you meet quarterly, the 3 months go by very quickly and you realize that, most people are doing work outside of this, and time just goes by and gets away with us. So I think maybe starting with some structure will help people. And then I think it always goes back to, we've talked about this on the council before. There was a time where there was a member who really was not participating, and no judgment there. Sometimes life gets busy and you thought you could commit and you can't. And I think we do have to look at that as well, because there are people who are anxious to serve, who might be in a different position and be able to commit more effort. So.
All great ideas, and it looks like we've got people in the chat that are willing. So Tara, to confirm, one can sit on a subcommittee or a work group, whether or not the appointment letter has come in, right? Is that accurate according to legislation?
Well, yes, but what we really need to do is also look at the bylaws. So
okay.
the bylaws that I sent out, and I'm thinking now too, if we want to continue some of this discussion, which can be then added into some of the bylaws. So if this is something that we want to move forward with, as far as council members serving on one committee, for example, I put in the two subcommittees that we currently have, which is the housing and education and training, in the bylaws. But if there's other standing committees that we would like to develop or somebody would like to have, that can be added. But there is also room for ad hoc committees in there. So I think that, again, this is all really good timing for this conversation, because we do need to, as a council, we need to pass the bylaws. So, I took what was previously there, updated it based on, changing this over to OPM and updating it with the current legislature language and, statute language, So I think this is all good timing of this conversation. So Mike, I think you had something you wanted to say too.
I was just looking at two of the biggest barriers our individuals have is on-call support and startup funds to get into an apartment. Those are things that could be added to the waiver and done under our current funding cap.
Thank you for that.
Could you elaborate a little bit on that, Mike? Just a bit.
A lot of our individuals need that 24-hour on-call support. And that would enable them to live on their own. We could add, it's similar to a service DDS offers. It could be added to the list of our waivered services and be done within the $50,000 funding cap that we have. You know, our guys do great when everything goes right. It's when something goes wrong, they fall apart. Well, I haven't had a day yet where everything went right. And that's where the on-call support would benefit a lot of people.
I would agree.
So Tara, for the existing subcommittees, housing, education, training,
Education and training is one. So that was yeah. So if you want to reference the bylaws that I sent out, it's in Article 5, standing and ad hoc committees is the proposed language. And so there's 2 standing committees, autism supportive housing and autism education and training. And then we have the option to add any ad hoc committees as well. So those were the 2 that were proposed at if you remember at the last meeting in March, I asked for suggestions for subcommittees, and those were the 2. There was an ad hoc one for CSDE to provide feedback, but that's not a standing committee.
Okay.
Can I ask a question, Tara and Jimna? So within that same section, the last bullet, D, indicates council members may serve on one or more committees. Do we want to say as a council that, you know, must serve on one or more committee? Because if we say may, we'll be having this conversation over and over again. It's and, you know, it's the nature of the beast where, you know, there's good intentions and things get in the way. And I'm not, you know, I'm not counting myself out on that. You know, it's just human nature. But I think having a little more meat around it, I also think it's fair to people who are either on the council, if this is a expectation that they don't feel they can meet, or if for new council members, the understanding what the expectation of the commitment is always important in my view.
I agree, Lynn, and I want to just maybe, and Gemina, not to you know, overstep, but I'm happy to share my screen. And maybe one of the first things that we should do is review what this council has been tasked to do.
Yeah. Yes.
So if you guys would like, I can just share my screen so that everyone's seeing. I know the members were sent.
Yeah. So.
Okay. So are you guys seeing that? Okay.
Can you zoom in on your Word document a little bit? Thank you.
How's that?
Good.
Mm-hmm.
Okay.
Can we say under the general statute, or is it not worth it in case the statute number changes? I just wanted to be clear where this is lifted from.
Yeah, I was going to add that once everything's
great.
So I guess my first question is, knowing that we have 2 subcommittees, standing subcommittees, that we already have people interested in, based on, you know, the duties of the council at large, do we feel there needs to be another one? And, you know, we would need somebody to take responsibility to chair that as well.
No, I am. I think we have our hands full with the two that we have. And I think that we really need this to be a year that we accomplish stuff. And I personally feel we need to stick with the two committees. I think they're both important issues.
And I put in the chat, I agree, Lois. I think, you know, if we were to add anything, which I don't think we do, I think we have to be very thoughtful around what the goals and objectives of any additional ad hoc committee would be. And apologies that my camera is off. My internet is not working very well. So, but like I said in the chat, I think if we were going to add, we really do have to think very carefully about what the specific goals would be so that we're not just adding a committee because we're already finding some challenges with whatever it is that's happening right now with getting people to be part of those subcommittees.
Stephen, did you have a
Well,
comment?
my comment was basically the same. We're having enough trouble staffing these two committees. And I'm thinking that it's not because of lack of interest in the subject matter of the two committees. I just think that people aren't volunteering, and that if we set up more committees, we're just going to be further diluting the pool. That's all.
My eye is drawn to number 4 in the two committees that we do have. Can we make sure that we are identifying strategies specifically for racial minority group members? I think that we could fold that in to make sure that that would be included in the two existing committees that we have. I don't know if I'm reading that out of context, but that's what my eyes were drawn to immediately. I don't think that we have, and I know even when Jennifer Crown reports, we don't have a lot of, it's not a required field to find out who, the demographics and so it's hard I don't even know how we would measure that or, start to look at the numbers that we do get reported, that she gets. But if we could fold in that prioritization within education and training and housing, I think that would be, we could kind of not kill two birds with one stone, but we can make sure we're covering off on that. Did someone else say number 5? I didn't see, I saw it pop up in the chat.
In the chat, yeah.
Dr. Schlegel, what were your thoughts there?
Oh, I just was commenting that we haven't been addressing that, and I don't know how. I mean, just as a group, has not tended to be our focus in the time that I've been involved here. So I just was curious how we are addressing that.
We used to have Birth to 3 here present to us. Tara, I think that was probably before your time. I don't know.
We have members from Office of Early Childhood. I did get an email from Mary Beth Miller today that she was not able to attend our meeting today. But if that's something that we would like to have a presentation on, I can ask them to, be prepared to. I send out an email to all of the agency representatives that are part of this, a part of the council, or and ask for any updates to be presented at the meeting. So just so everyone's aware, that does go out to see if there's any relevant information. So I did not get anything from OEC. If we want a presentation from Birth to 3, I can absolutely, arrange for that and get that on the agenda.
I think with the, new members and, with OPM's oversight now, to Dr. Schlegel's point, we can kind of maybe not form a subcommittee, but we can start to just level set what is, the presentation today, right? And then as time allows, we're at least able to be mindful of that. I don't know if that's probably not the be all end all answer, Dr. Slagle, but I think that would be beneficial to at least get that level set presentation.
I think that's.
Can we make that request, Tara?
Absolutely.
I think it's helpful that if this is the scope of what we need to cover, I was not even realizing that was a component. So that's good to know that we should focus on that.
So, Michael, I think you're in your chat, you were saying, goals and, tasks and goals for each subcommittee. I think that's what Stephanie was getting to as well. In the corporate world, I use something called RACI, RACI, responsible, accountable, consultative, and to inform. So that's kind of where my mind goes when I ever am assigned a project as project manager in my day job. That I might even apply that, to something like these subcommittees, and we can assign those tasks, and we can make sure across the agencies that we're able to be informed. Like for number 5, we need to see what are the existing state guidelines, before we can even inform that, or make recommendations, etc. So that's kind of just kind of how my frame of mind on that. But we could apply that to the 2 existing subcommittees that we have today to get us started. And I think we're almost coming up at quarter of the top of the hour. So I do want to.
I may suggest that we continue to review the bylaws and maybe put out a special meeting so that everyone can have an opportunity to read through and provide some feedback and suggestion off, that can just be sent directly to me. I can combine that, and then we can schedule another meeting to do, a better review and get everyone's feedback.
Yeah, I think if we could get that before the holiday of the 4th, 4th of July, while everyone has a little fire in their belly after today's meeting, that would probably be better, Tara. Not to heap more work for you.
No, that's fine. I'm just going to stop sharing. And it was mentioned that yes, some of those are mays and some of those are shalls. That's how it is worded in legislation. So as you're reading through those, that was intentional. And then, so I would say, well, for next steps, then, Jimna, we can schedule a new meeting specific to the bylaws for members, and I can work on getting that scheduled. And as long as we have a quorum, we can update that. And I'll just send out another email asking for everyone to provide feedback. We will just need at least a majority of members to show up for that special ad hoc meeting in order to pass the bylaws.
Understood. Okay, we kind of jumped around on the agenda a little bit. Where are we at, Tara?
We did. That's okay. I think that we'll skip work group updates because we know that needs to be worked on. And so we'll just leave time for additional general. We have our next steps. So general comments and or questions or anything for the good of the order. Now that we've kind of decided what we're going to do for the bylaws.
Can I just, so that we make sure we don't leave without clear expectations on the work groups, particularly for myself as a chair of one of them. So if we can get the list of who is on the 2 committees, I think who's on or who for the second, not the housing, but the education and training, who expressed interest. And then that way get a meeting on the books ASAP. The first meeting, we really had very few folks on. The folks that were on, we had a really good discussion, I think, and we were trying to essentially create a charter, which is somewhat like, Gemma was talking about, what are we coming together to do? What's the expectation of the group? And that's about as far as we got in the first meeting, other than trying to, all of us discussing that we thought what was important to do is to get sort of a lay of the land of what's out there currently, and communicate that, and decide what might be replicated, what might need to be created. But that, as I said, I think that way, if we have that and we get a meeting going, at least we'll see where we have opportunities. And if we only have 3 or 4 people on both of those committees, and obviously we're not getting the participation of the group. And I think that's a good starting point. So.
Yeah, I'll send out, email at the end of this meeting today, recapping what our plan is. And then I will ask everyone to notify me again if if there's interest in, that. And again, as people, because I'll request feedback for the, which I can send in a Word document so people can easily add comments or make edits. So I'll send that out to the member list, and everyone can take a look at those, and I will recap that, Lynn, as well, and get interest for subcommittees.
Thank you.
Absolutely.
Do we have any new members that would like to introduce themselves that have been appointed? I see some names, and I wasn't sure if everyone, we met Christine, and I didn't know if there was anyone else that we should hear from.
Hi, I'm relatively new. I'm Patrick Hike.
Hi, Patrick.
Hi, everybody. I'm the current director at River Street Schools and Programs.
Great. Nice to meet you.
Thank you.
And
what does River Street do?
Hi,
or what programs?
Sure, we're associated with CREC, and we provide. We actually have a school in Windsor and a school in Bloomfield for children with primary diagnosis of autism.
Great.
And
good.
Patrick, welcome. And you're really the newest member, and everybody else who was, besides Christine being a new member, appointed. So I don't have anyone else on my list, Gemina.
All right, good. I appreciate that. And then I don't want to forget, we have the OPM survey. We also have Stephen's survey from Disability Rights. So we do have a few follow-ups to-dos for all of us coming out of this meeting. It sounds like Stephen and was it Jake? I forget his name, what he presented earlier.
And Heather.
Both of those surveys can be passed along to other individuals. It's not just limited to feedback from this group, correct?
Absolutely not.
Correct.
You're both nodding.
Yes, we'd very much like you to spread it far and wide. The more responses, the better. So thank you for checking on that.
Yes,
okay.
Thank
you. Okay, great. And Heather, yours closes July 26th. I think I wrote down. And Stephen, when does yours close? You said you need that.
The 25th.
The 25th. Okay. So it's open for 30 days.
Right.
And are they both anonymized? That's such a tongue twister.
Yes, ours is anonymous. There's no place even to put a name or anything. So yes.
Okay.
Ours is optional. We don't need a name. If you want to put your name, you can.
Okay, great. Christine?
Sorry, I just had one question going back. If you could identify, so I understand, I know that there's 2 tiers of the council, right? There's the council members, the chairs and such, and then there's the state agency representation. If you and the chairs and maybe Tara can look through the bylaws and understand the state agency reps' obligations to the state subcommittees, we don't want to impede open conversations, but I just want to make sure that like our bandwidth and our ability to be on these subcommittees also doesn't then impede the ability for all of you guys to team and think collectively to bring stuff back to the specific state agencies. So if you could just let us know how we interact as state agency reps, I'd appreciate that. Like for
And the
Kristen,
bylaws,
in OEC or what have you.
right, absolutely. And the bylaws don't state anything currently and differentiate between those appointed at the commissioner level and from state agencies and those, you know, appointed. But I will tell you, so there are 15 positions that are appointed that are outside of state agencies. So these are community members, licensed professionals, people with autism, parents, guardians, etc. And then there's 25 total members of the council. So the remaining are state agency representatives. So there is, you know, a quorum, so to speak, because we need 13. I mean, right now our quorum is majority, so that's 13. So again, that's something, if we want to differentiate that in the bylaws, that would be a recommendation. If you want to propose any language, or the state agency representatives want to propose that, please, you know, include that along. Currently, there's nothing listed.
If I might ask, this is an aside from what you're talking about, but I suspect that we have a number of people on this council who are community members. I'm particularly concerned about parents that are just not active. And I think we need to be looking at that. And if they're not, or they're not able to be, you know, again, this isn't a judgment, but we need participation. And so I think we need to be looking at that and seeing whether we should be replacing these people.
So Lois, I also want to draw everyone's attention that I did add language, you know, because these positions are appointed and because some of the, you know, the importance of the work that we're doing. I did add language in the committee section that community members could participate on subcommittees. So that would be a great opportunity. You know, we've had a lot of interest from community members to participate. So even though somebody might not be appointed to the larger council, that absolutely we can, you know, keep that language in there to allow community members to participate on the subcommittees where we actually want to do the work and move this forward. And, you know, so please look at that and comment.
I will. But could we, could the housing committee, for instance, I don't want to speak for anybody else, but could you forward to us any names of people that have requested or have an interest in sitting on a committee outside of council members? Is that possible? So we can maybe contact them and see.
As things come in, I can do that for sure. I've had some people reach out specific to being a member of the council, not necessarily specific to participating on subcommittees. So I was waiting for these bylaws to be passed so that we had agreement on how to proceed forward. So once we have that, that would be, I would be happy to maintain a list of people as that, you know, interest comes in, that we could then, I could disseminate that among the, to the subcommittees.
Okay. And what do you think about the idea of looking at, you know, some of these community places on the council as far as active participation? I mean,
if you want something listed in active participation, I mean, I can suggest some language that we've used on other committees at PM that we could, state something along those lines. So I think that if that's something that you guys would like to see in the bylaws, by all means, either suggest that, and I can, come up with some language to include.
Okay, I think that's important because we've had this problem all along. It's not a huge problem, but enough of a problem that it makes it difficult to get participation. And I think that we need more, my own personal feeling is that we need some more parents on this council.
And I can I'm happy to send out a current member list with contact information. Again, some of that I was waiting to update publicly until we had all appointments. So I will just be putting vacant on those ones that I don't have official yet.
Thank you.
Yep.
That was an issue I wanted to raise because I'm a person who likes to have a definitive date or not have things floating. Do we have any idea of how long we're going to wait to hear from the people who haven't accepted their invitations?
Oh, it's not that they haven't accepted them. It's that the legislators haven't appointed. I haven't received the official appointment. So if you look in membership of the council, so in statute, it was listed on who gets to appoint each position.
Right.
So I had to reach it being a short session. It was challenging to get in touch with everyone. But like I said, Secretary Beckham is going to help assist me in getting some information, requests out to the legislators that I have not heard back from.
Okay. Thank you.
Lynn, did you have a question?
Sure, just real quick. I know we're up against it. So just back to, I think, what Lois's conversation about participation. So two things. One, I think the committees can be a way, having people who are not on the council involved in the committees can be a way of really vetting people, frankly, and seeing, we certainly do that here at the hospital before somebody wants to become a board member, join a committee. Because if you can't, you may have very good intentions, but if you can't rally to be participate in the committee and actively participate, the likelihood of you being a good board member is less. The other thing I don't know if you were alluding to this, Tara, that we could consider potentially, and it certainly is on other boards that I'm on, where the bylaws actually state that in order to be considered an active member, you must participate in X percentage of the meetings, right? And honestly, the fact that we are Zoom largely now negates a lot of the challenges. I mean, we're all going to miss some, things happen, but I think, again, I'm not recommending it. I'm just saying that that is a way that I think is a very clear expectation. And then if somebody's not able to commit to it, then it's our responsibility to talk with them, see if there are barriers, try to mitigate that. And if not, maybe they have to consider that's not the right time for them to be on the council. Just a thought.
I like that. Yeah.
That's exactly what I was alluding to, Lynn.
Okay.
All right. I think we have 2 minutes left. Do we have any other questions or announcements?
Yeah, I have nothing else for the good of the order.
I just wanted to recap and regroup on Doriana's proclamation that Lynn and I were able to participate at the Autism Day at the Capitol back at the end of April. And Senator Kissel, and there was 2 other legislators that were also present, but made some very heartwarming and genuine, just lovely remarks for Doriana's work. And I did take those back home to my post office. So those did go to her children and her family members. So I just wanted to share that with the council, just in case anyone was wondering. So they were both very appreciative And the recording of the Autism Day at the Capitol is available. I think it's on CTN, but you can Google it. It's on YouTube. So just in case any of you wanted to hear the remarks. Lynn, I didn't know if you had anything else you wanted to share about that day.
Oh, I thought, you know, it was unfortunate her kids couldn't be there,
Yeah.
but I thought it was a very appropriate recognition of her longstanding commitment. So
Yeah. Agreed.
bittersweet. Yep.
It was. It was. All right. Are we ready to adjourn? All right. Thank you all. See
Thank
you
you,
soon.
everyone.
Bye-bye.
Bye.